who's got a fascinating story, which I'll let her tell you about herself. But she's a very inspiring lady. And Laura, who's come along too, but has already caused havoc. So she's under control now. Is there any more you want me to say about you? That you do yourself?
Yeah. Okay. Right. Good afternoon, everyone. Hope everyone's had a good lunch and are feeling refreshed. I'd like to begin my presentation with a fun exercise, but I'd like 2 volunteers to join me at the front. 2 brave volunteers. It's nothing scary. Anyone that would like to come? Yeah. Okay. Stand either side of me. Yeah. Okay, and introduce yourselves. Nicola and
Lindsay.
And Lindsay. Brilliant. So I have a bag here, and inside of this bag are coins. What I'd like you to do is to put your hand in here and to feel for the coin without looking, to see whether you can actually identify what's in here without using your vision. So I'll hand you the bag.
Okay.
And
is there a particular coin I'm looking for?
Any coin you like. And once you've found one, try and by touch figure out what you found. And I'd like you to tell her whether she got it right or wrong.
Okay. What's golly? I'm really not good at this. I'm trying to look for 50 pence. Okay. Right, I found one.
What do you think it
It's
is?
a pound coin.
I don't know. Is she correct?
Have a look.
Yes.
You were right. Brilliant. Now I'd like you to have a go as well. See how you find that
Has she
exercise.
just taken out the easiest?
Look at harder coins. Have a feel, pick a coin.
Definitely some tricky ones in there, I'm sure.
Is there any foreign
That
coinage?
feels like it might not be English. Oh, they're
No
all
peeking.
round edge.
I use contact lists.
I'm having you. Oh God. Okay, this could be one of 2 things. But yeah.
What do you
Yeah.
think it is?
2p.
Are you correct?
Yeah.
Well
Brilliant.
done.
Excellent. You both got them correct.
It was hard then.
That was my next question. How did you find trying to identify the coins using only your sense of touch?
It's hard because they're all circular. So like you were looking for a 50p, so that would have been easier. But then you think you know what the size would feel like, but I didn't know if it was a 2 or a 10
Yeah.
Yeah.
because you can't gauge the size. It's hard.
There's definitely a bigger coin in there as well. Big round one. Just to confuse and stuff.
What words would you sort of use to describe your experience of just relying on your sense of touch to find the coins? Would you say it was challenging?
Yeah, definitely. Yeah, it's quite tricky.
Yeah.
And just time consuming.
Yes.
Because you're just making sure you're absolutely right about this. But,
Excellent.
yeah.
Thank you so much for participating.
Do we get to keep the money?
There's a raffle at the end.
Change the cards for no reason.
Thank you so much.
Oh, sorry, I've dropped the money now.
We'll just leave it on the side here. Right. So thank you so much for participating in that exercise. So the word that came up was challenge. Now, we all face challenges in life. It's actually a part of life. But can you imagine if suddenly doing basic activities like trying to identify coins, reading labels on a medicine box, or climbing a flight of stairs, or even reading the paper, basic tasks suddenly become very, very difficult. Can you imagine how that must feel? My name's Jana, and I'm here with my guide dog Laura. I'm a professional speaker, a workshop facilitator, and a mindset coach. I'm passionate about empowering people and creating positive change. I'd like for you to imagine that you're a 17-year-old teenager. Everything in your life is pretty normal. You're healthy, you're vibrant, you're doing really, really well at college. And then you're suddenly struck down by an extremely rare illness that leaves you fighting for your life. You have no idea that within 12 months you'd lose your eyesight, You'd have major surgery to remove part of your lung. You have to adjust to life as a visually impaired person. You face major health challenges and try to find ways to improve your quality of life, and you lose your purpose in life. That was me 16 years ago. I was prescribed penicillin to treat a fever, but I had no idea that I was allergic to it. Within a matter of hours, I had quite a severe reaction to it. I began to experience blistering to my skin, to my eyes, to my lungs and my throat. My family had no idea what was actually happening. We called the emergency services and I was sent straight into hospital. There the doctors did an assessment and I was given an anti-inflammatory injection to help calm down the symptoms. I thought that was the end of my ordeal, but I was very wrong. I was kept in hospital as my symptoms began to worsen. The blistering had actually spread to my internal organs, to my lungs, and to my digestive system. I was left in agony. I felt like I was being burnt from the inside out. I was then moved to an intensive care unit, and I was treated like a burns victim. The blistering of the external body had actually ruptured and left me with open wounds, and I had to be wrapped in bandages. Every day they applied amounts of cream and lubricants to avoid any external infection. I don't remember a lot at the time because I was in a semi-state coma. In the end, I lost 60% of my skin. I grew new toe and fingernails and looked very different physically and was quite unwell. I spent some time in hospital and had to learn how to walk again. But while all this was happening, I still didn't know what my diagnosis was. After asking my doctors, I was told that the condition that I'd suffered from was a severe form of Stevens-Johnson syndrome known as toxic epidermal nephrolysis, which only affects 1 in every 3 million people. I was very fortunate to have survived the illness. As I spent time in hospital recovering, my vision slowly began to deteriorate, and I was moved from one hospital to another. I spent about 12 months recuperating at home, trying to get myself back on my feet again, while all the time struggling with my health. I've come really far in my life, and I have to say a lot of it is down to the care that I've received as a patient. My healthcare journey and my patient experience. Today I want to offer you some insights into things that have actually helped me to recover and get better and become an empowered patient. There's 3 main areas that I'd like to cover, and I'd like to begin with my diagnosis. So I briefly mentioned that I wasn't actually informed about what had actually happened to me. I was very young at the time, I was 17, and there was some confusion about what had actually happened because of the symptoms that I was displaying. So I feel if I was told exactly what had happened from the beginning, regardless of how young I was, it would have made all the difference. A GP said to me a little while ago during a presentation, could the reason of being you weren't informed is because of your age? And my answer was perhaps it was. But looking back now, I feel like being better informed as a patient would have helped me to gain a better understanding of how to manage my condition and to seek support and help for this rare condition. With regards to diagnosis, I feel that there's one particular quote that has really helped me to really do sort of recover and think differently about my life. It's a quote by a poet called Maya Angelou, and she says, "People will forget what you did, people will forget what you said, but they will never forget how you made them feel." And I do believe this is absolutely true. And I say this because of my own personal experience. I want you to picture this scenario. You're in hospital, in your hospital room with your family. You're having a great time, the TV's blaring in the corner, you've just had your second helping of jam sponge, and life couldn't get better. And then suddenly there's a knock at the door, and in walks in an entourage of doctors. The mood suddenly changes, the energy changes in the air, and you start to feel a little bit nervous. Your doctor approaches you, and he has a somber look on his face. He speaks and says, "I'm sorry to inform you, but there's nothing further we can do. It's inevitable. You're going to lose your eyesight in both eyes." Can you imagine how that must have felt? You're in that room, the mood is high, and suddenly your life is turned upside down by a diagnosis, a life-changing diagnosis. To think that within however many months, you won't be able to see again. You process this information, and as you do so, the doctors turn to walk out. You're left disheartened, you don't know who to turn to, and you spend a moment just almost grieving about your diagnosis. When I look back at this situation, I think, what could have made things more empowering for me as a patient? What could the doctors have done differently? When you're dealing with a life-changing diagnosis, the one thing that's so important is to be listened to as a patient and to be offered some kind of ongoing support. Being newly diagnosed with a sight impairment, having someone there to say to me, there's organisations to help you, such as charities, the RNIB, or some kind of support network, would help me to cope with the condition a lot better. For me, I was very lucky because I had a close circle of family and friends, but I had no idea about the actual support that was out there for me. This came about through chance. There was a sight loss liaison officer who just happened to be at the eye clinic, and she realised what was happening with me, and I had a conversation with her, and that's when I began to learn about the opportunities and the options that will help me to resume my education and to get my life and independence back. So I know there's a lot of patients out there that I've spoken to who've been in a very similar situation. Just being provided with some kind of information, even if it's the smallest piece, just really sets the ball rolling to help empower a patient to move towards regaining independence. Losing a sense is almost like having your independence taken away from you. A more empowering example that I could give you, where the doctors have actually listened to me and offered encouragement and support, was when I was referred to the Glenfield Hospital in Leicester. As a result of Stevens-Johnson syndrome, I suffered a lot of scarring to my lungs and was left with a condition called bronchiectasis. With this condition, I have to do regular chest physio, so nebulizers and chest clearance, and also take some anti-inflammatory inhalers also. And that's a daily routine for me. And I've had several hospital admissions in the past caused by mucus plugging to my lungs because of inefficient clearing. And during an admission in 2014, my lung had collapsed. And I honestly thought that I'd be in hospital for just a week or two, but this went on for about 8 weeks. I was under a lot of intense chest physio 4 times a day. I underwent rigid bronchoscopies, quite intense treatments, day in, day out. I was away from my family and physically tired and mentally drained as well. By the end of this admission, my consultant and physio came into my room to deliver some disheartening news. I was told that my lung may not fully recover. This was not the news that I was hoping to expect. My goal was to leave the hospital fully recovered, but that wasn't the case. Now in this situation, I could have left the hospital feeling disheartened, but the one thing that turned things around for me was the empathetic words used by my doctor and my physio. They told me my diagnosis, but empowered me in such a way to believe that things would get better. They empowered me to believe in possibility. They said to focus on what I can do as opposed to what I can't do. And that inspired me to leave the hospital, to resume my health and fitness regime, and ultimately to get better and feel empowered as a patient. That made all the difference to me. Another thing that I'd like to speak about is my actual health condition and the health challenges that I've actually had to overcome. So I have just mentioned the lung condition, and that's been a big problem for me ever since 2002. Firstly, because it wasn't managed very well, and secondly, because it wasn't diagnosed properly. So I had no idea, again, what was happening, what condition I had, and how to manage it. It was only through being referred to the Glenford Hospital that things started to change. The approach there, patient care, was very, very different. So the issues that I had really are the breathlessness, the fatigue, the tiredness, having to deal with a constant regime of nebs and chest physio. It had an impact on my life. I felt like I had no life. So for a long time, I was in denial about having a lung condition. Funnily enough, adjusting to being visually impaired was a lot easier. It was a physical condition. I was able to get support eventually. But with my lung condition, nobody was aware of it. It was something I kept very sort of private and to myself and dealt with my own way. But that in itself had consequences. I wasn't managing my health very well. I wasn't taking responsibility. In 2010 was probably my worst year of admissions. I had 3 recurrent lung collapses, all for the same reason. Because I wasn't doing my treatments and I wasn't exercising as well. My doctors had told me time and time again, this is what you need to do in order to keep yourself well and healthy. The reason why I didn't as a patient was because of denial. And I didn't want to accept that I had a lung condition. During my 3rd admission was a turning point and a bit of a wake-up call for me. I realised at that point that things had to change. I couldn't continue feeling sick and unwell like I had been. I didn't have much of a life living that way. An empowering conversation again with my physio changed things for me. And I realised that I couldn't continue living the way I was, and it was up to me to actually change. I developed a very, very good relationship with my physio and the team there. We had a foundation of trust, empathy and communication. And I feel for me as a patient, having that as a foundation increased my compliance to doing the prescribed treatments that I was told to do. Whereas before that, there was a bit of disconnect of care. Because I felt I wasn't being understood or listened to, I was very reluctant to follow any of the doctor's instructions. So at this point, I decided to actually listen. Listen and do the treatments, and it made